Hey everybody, it's Dr. Eric with 11 Health Chiropractic, kicking off for another rock star day of helping people's spines, saving lives, taking care of people. So let's talk about treatment versus care, because there is a very, very stark difference and not a lot of people think about the contrast between the two. So to help illustrate that, I'm going to tell a quick story. Say it's the morning, you wake up, you're running a little late for work. You jump in the car, things are kind of hectic, you start going, you're maybe, doing your makeup, drinking some coffee, futzing with the radio, and you smash into a tree. You weren't going very fast, maybe about 10, 15 miles an hour, you smash into the tree and you're like, oh great, this is just what I need, beginning of a bad day, right? So you back the car up a little bit, you get out of the car, you go around front, you look at it, it's kind of dented in, and you're thinking, oh geez, do I go for it? Do I stop? Do I call somebody? I'm running late, I don't want to get in trouble with work, whatever the scenario might be. So you get back in and you try the wheel, and it seems to turn, you try to drive it a little bit, it seems to go, and you say, you know what, I'm running late, I'm in a rush, I'm just going to go for it. You go through the day, you get to where you need to go, and then days turns into weeks, weeks turns into months, months maybe turns into years, and you never bother to fix the damage. Now, I'm not a mechanic, so I don't know all the cascade of events that might happen with that, but imagine you have the alignment maybe knocked off a little bit. What's that do? The tires start wearing unevenly. That starts to affect things like the axle, and you ask yourself, is it good or bad? And ultimately, lots of bad things start to happen. And then the other question you have to ask is, does the problem typically resolve itself the longer we ignore it? What do you think? So now, go back to the beginning of that story. You were in that car. You hit that tree at 10, 15 miles an hour. Even though you might have been wearing your seatbelt or something like that, your body experienced that trauma. And there was actually a study done by Yale or Harvard, I can't remember exactly which one of the two big Ivy League schools back in early 2000s. They were looking at the damage caused to the occupants inside of a vehicle in a low-speed collision, particularly like your rear ender, fender bender type things, like less than 10 miles an hour, and they found that the threshold to cause significant damage to the occupant inside the vehicle is actually less than 10 miles an hour. It's close to like 8.1, 8.2. It's a lot lower than you would think. So now you're going through the day. Maybe you do this kind of thing. We've all done it before. Feel okay, yeah, maybe a little stiff here, but I can hack it. You go through your day. Days become weeks, weeks become months, months become potentially years, and what's happening to your body inside there? Is it getting better or is it getting worse? And then, fast forward a couple years down the road, maybe 10 years down the road, maybe 15 years down the road, you start getting migraine headaches, or you start getting shooting sciatic pain. You have a crisis that you can't deal with. You have to do something. That's typically when I meet people for the first time. And they come and see me, they're all hobbled up, they're coming through my front door and they're like, Doc, I'm hurting, take care of me. And they don't usually take care of me, they say they want to get rid of their pain. The pain that they've been dealing with, the pain that they've been adapting to. Maybe they've been doing things like Tylenol, you go to the bathroom, you open up the mirror, you have a whole array of different solutions to your problem, but they keep covering it up, never truly fixing the problem, and the problem slowly gets worse. Then we think about, so maybe it wasn't a car accident, maybe you didn't hit a tree, maybe it was trauma from when you were born, or maybe it was when you were learning to walk. Maybe it was when you were learning to ride your bike, or that tree house that you fell out of when you were 5 years old, or that fall you had down the stairs, or that first hit you took in football when you started playing, or maybe you were doing cheer and you were tumbling, or gymnastics or something and you fell and you had a bad fall. All those little insults to the spine that we just get up and we're like, oh, yeah, okay, yeah, that hurt, that sucked, but I'm good, I can hack it. You keep going, and next thing you know, days become weeks, weeks become months, months become years. Then you hit the crisis, and that's when you'll do anything to try to get back to where you were good. And so I take care of a lot of people, and I've taken care of a lot of people over the years that I've been practicing, and I find, bar none, The people that have the highest quality of life, that live longer, have better quality years to their life, are not the ones that I take or I treat when they're in crisis. Not saying that I don't want you to come and visit me if you are in crisis, because you got to definitely do something, but it's the people that we take care of for a lifetime. Because your spine is a lot like your teeth. If we applied the same mentality that we apply to our spine, to our teeth, what do you think would happen to our teeth? If I woke up this morning and I said, they're feeling pretty good, I'm not going to brush them. Or I don't go through and I don't go like, okay, this one's good, this one's good, this one's good, this one hurts, I'll brush this one today because that one's hurting me. If I applied that logic to my teeth and I only took care of them when they were hurting, what would my teeth look like? What would all of our teeth look like if that's how we did it? And that once upon a time used to be what dentistry was back in like the early 1900s. We basically ignored our teeth until they started rotting out of our face or rip them out, fit you with some dentures, and then problem solved, right? And then dentists realized, hey, we could do a lot to start taking care of people if we start showing them that you got to take care of these things for a lifetime. And that's really where chiropractic is at now. That's my mission in life, is to try to get chiropractic and the knowledge that we need to take care of our spine to the masses, much like dentistry has over the years. So I'm offering a special to anybody that's curious about seeing what kind of state that their spine is in. It's a $40 invite to get you and your entire family checked for only $40. That'll include the entire examination. That'll include any x-rays that we have to do, because my life's mission is to take care of families and their spines and help to empower them to have the best, highest quality of life as possible. So we're here. There's a link in the description below. You can click on that. You can request the appointment. You can go to the website, lovehealthchiro.com. You can actually request the appointment. You can schedule the appointment right online. If you schedule your appointment and you want to get the whole family in, just let me know when you get here that, hey, I've got, husband, wife, kids, grandma, whoever else needs to get their spine checked, and I'll honor that discount for you. So love and appreciate you guys. Hope you're having a rockin' Tuesday. Looking forward to opening up the office here in about an hour and taking care of some spines. Have a great one.